This presentation is about the reduction of restraint and seclusion episodes related to violence and aggression towards staff on adolescent unit at the forensic hospital. Healthcare workers in inpatient units are at a high risk of aggression and violence all over the world. A study by Ahem in 2020 emphasized that the general restricted nature of forensic environments, although vital for security, may also lead to heightened violence risk through tactics perceived as offensive by patients. The aggression towards staff such as mental health nurses, doctors, hospital workers, allied health staff has reached the level of a public health concern, and the need for violence prevention measures to prevent harm to both staff and patients. Integrated approaches are necessary throughout the healthcare continuum to address the numerous risk factors related with the prevention of violence and aggressiveness against staff and other patients, including the variables that impact the health and welfare of young patients with mental health problems. Keeping track of the health system's performance through monitoring can provide valuable insight to government services providers and the public. There's need to conduct a needs analysis and look at the data to identify the issues that exist on the adolescent unit at the forensic hospital. According to the hospital's IMS system reports, there were 48 incidents relating to violence and aggression that were recorded between the first 6 months of 2023 on the unit. Of those 48 incidents, 32 of them were related to violence and aggression towards staff, such as registered nurses and allied health, and resulting in adverse staff shortages for such a challenging forensic hospital environment. 5 of these incidents resulted in serious physical and psychological harm to staff. Patient abuse has a significant financial impact due to resulting staff illness or injury, compensation claims, as well as the implementation of managerial measures. This was highlighted in a study by Hallett, Huber, and Dickens in 2020. This project aims to identify the solutions to minimizing or eliminating the violence and aggression towards staff and patients in a high secure forensic adolescent mental health ward and reduce this number of incidents to 0 by June 2024. In this study, we're going to use the Plan, Do, Study Act to implement this project. A fishbone tool was used to ensure that any corrective actions put into place will resolve the issue. And this fishbone tool will also be used to avoid the reoccurrence of issues or employee turnover and staff burnout due to staff illnesses and staff shortages and working under intense stress. The fishbone tool will also be used to identify the possible causes of the violence and aggression towards staff on the unit. And the outcome realization, the target outcome would be the reduction of restraints and seclusion incidents, which would be measured by the decrease in the number of IMS reports that are reported by staff. And the target for this will be 0 incidents by 30 June 2024. And this responsibility falls under the Deputy Director of Nursing. The next step will involve the identification of key stakeholders and members. For this project on the adolescent unit of reducing seclusion to 0 by 2024, the project sponsor will be the Deputy Director of Nursing, and the project manager will be the Nurse Unit Manager 2, and the project team members will comprise of the NUM1, the team leaders, patients, family members, and allied health staff and nurses. The stakeholders have the responsibility of being visible champions, being committed, able to resolve issues, balance the role requirements, and being responsible. The project team members have the role of maintaining staff morale and providing staff training and development. The impacts of this project will be improved patient outcomes, reduction in staff injuries, staff patient care satisfaction, increased staff retention, reduced number of sick days, reduced financial costs due to workers going on workers' compensation, and utilizing overtime as a result of staff shortages. The possible challenges that can be encountered include organizational culture, which can be overcome by setting clear goals involving staff in every step of the change, use of reflection, clinical supervision sessions. Another challenge will be lack of leadership support, which can be countered by presenting the plan to management with clear set goals and objectives, regular updates to top management, and involving top management in the change process. Another challenge that can be faced is staff shortages during stakeholder training sessions, and training can be done on weekends during changeover times when they increase staffing on the floor. The planning stage involves communication of project objective through presentations, staff meetings, emails, debriefs, informal meetings, pamphlets, and notice board. The planning stage also involves the identification of change agents and project champions. It also involves the training of identified stakeholders. And during this planning stage is where the activities and tasks are identified. The estimated financial budget is also discussed during this stage, and estimated resources that are required. And the training needs assessment is also done during the planning stage, and which determines which groups require training to deliver the anticipated results. During this stage, this is where they will also conduct a kick-off meeting of the project. The next step will be execution of the project. This involves breaking down the tasks and assigning them to team members and also giving them a timeline. It also involves communicating the plan to maintain transparency, and it also involves running quality control. And during the execution stage, this is where tasks are broken down and assigned to team members, and these team members are also given a timeline for them to deliver these tasks. The next step will be reporting and monitoring. This step is where we assess the progress of the project to achieve zero seclusion incidents. This is where regular updates of the project to the DDON and NUM2. This stage involves coming up with a status report, progress of the project, risk management report, issues report, and possible recommendations. The frequency will be fortnightly and at every monthly business meeting. In this monitoring and reporting stage also helps to spot if there are any overlapping tasks in the project. Project evaluation is that incident management systems are reviewed to see if there's a reduction of incidents, and in our case we want the incidents to be zero by June 2024. We also evaluate the cause audits report. We also conduct cause audits. We also analyze the rosters and deployments to check if there are any staff absences or if there are any sick days taken, and this will be an indicator of staff overall satisfaction and staff attendance. What expenditures on staff over time, gathering feedback from stakeholders, patient satisfaction surveys, staff satisfaction surveys, analysis of seclusion and restraint registers, and also using an independent facilitator to gather feedback and lessons learned. This independent facilitator will come from a different ward so that they come with an open mind and they'll be non-judgmental and unbiased. We'll also learn from our mistakes or failure during this stage. And during this evaluation stage is where performance against planned schedule to see. The last stage of the project will be project closure, which involves analysis of project performance and evaluation of the team performance and allocation of remaining resources. The closure project checks the output, if the output has been reached, and in our project, if there is zero incidents by June 2024. It also helps to check what has worked well and what could be improved. And during this project closure, we will continue with maintaining practice of zero incidents. We will review again in December 2024, and we will also recognize our stakeholders for participating in the project. And the last slide. And these are the references for the presentation. Thank you.